Hello everyone, and welcome to today's webinar, Designing Events for an Insecure World, presented by Meetings Today. My name is Tyler Davidson, and I'm Vice President and Chief Content Director with Meetings Today. And I'm excited to welcome you to this Zoom webinar. Today's webinar is worth 1 hour of credit through the Events Industry Council for the CMP. You can find a copy of the certificate on our global webinar club page, and we encourage you to ask questions during the presentation. You may submit your questions at any time by typing your question in the designated Q&A area and then by hitting send. And should you experience any technical difficulties, please send a message in the Q&A or chat area or call 800-553-8878. We would like to thank today's sponsor, Destination Colorado. Their partnership always allows us to bring this webinar and other webinars to you free of charge. So thanks to Destination Colorado. Now I'd like to introduce today's speakers. Joining us are Tahira Endine with Site Global, Tracy Stuckrath with Thrive Meetings and Events, Gareth Heyman with More Events, and Dr. Jonathan Spiro with In-House Physicians. And with that, I would like to extend a warm welcome to our panelists, and thank you for joining us. And I'm going to turn it over to Tahira, who's going to kind of carry the heavy load and really act as the moderator today. So over to you, Tahira.
Well, hello, everybody. Thank you so much. I'm so excited to be here with this panel. These are all people that I know and respect, and I know that they have really great opinions as we go through this time that is unprecedented. You know, as we pivot, identify, indemnify, prevent, detect, respond. Event and meeting professionals in every sector have a new vocabulary and new design elements to consider. What we're not going to talk about today is cleaning, physical distances. Last week on Meetings Today, the webinar deeply covered the travel and hotel design experience, so check that out. We're going to talk about some different things today. So the live event experience now and through the summer, 6 months, and then we're going to get out our crystal ball. So, and we're also going to deep dive a little bit more into incentive travel. So a tool that companies have effectively used for decades as the high bar of recognition and reward for top sales and service talent, and how we need to adapt it because as it becomes a different conversation. So we know that incentive travel works by immersing participants in motivational, transformative, high-touch personal travel experiences that is designed to drive loyalty, retention, and even affect recruitment. So looking at it through this lens, as well as the greater lens of meetings and conventions in general, let's really look at how we're going to create a comfortable environment and get people traveling again. So starting with right now, so I'm going to start with Gareth now. So Gareth, with your event, you are the wizard of all things with More Events. And so you've touched on every kind of event over the past 25 years. So let's start with the state of the industry from your perspective. How are your clients feeling about meeting in the next 3 months? I'm assuming, like all of us, you push the meetings forward. Are they meeting in the next 3 months? And if so, what are they looking for from a security perspective?
Yeah, thank you very much, Tahira. Certainly a question that everybody is on everybody's mind, and really, I wish I had that crystal ball and could predict fully what is going to happen in the next 3 months, 6 months, 9 months, and things as we move forward and how the industry transforms itself. People are clearly, as we're 2 months into this, past the shock phase and dealing with what tomorrow looks like and how are they going to respond to the situation that we're in and understand what tomorrow brings and the comfort levels and the security levels, like you said. At this juncture, we have probably pushed all of our live meetings to either fall or to digital. Or cancellation in some cases. We obviously tell people there's a very strong opportunity to transform their programs now and frankly forever into a digital platform. We have researched a lot of platforms. We're platform agnostic at More Events, and we want to make sure that we match the right piece to the people that are coming to us, much in the same way that we match the right hotel or destination to what we're doing. That's a very big part of our job in role playing. Of the whole timeline of things we put together. People are still, you have to understand your digital maturity, you have to understand the demographics, and you have to understand what their goals, objectives, and budgets are and how they're going to feel in 3 months.
So what we're saying right now is that in the next 3 months, we're keeping people secure by keeping them at home and creating digital events. I
Very
get
much
it.
so.
So yeah, now I'd love to hear, we've got so many people here joining us today. And we'd love to hear from you as well. If you want to just put up into the chat some of the things that you're doing in the next, and again, let's look first at this 3-month window of what you're seeing as well. So Jonathan, Dr. Spiro, your organization are the specialist in personal health security for meetings and organizations also in their home offices. So thinking prevent, detect, respond, what are you recommending to your clients who are meeting in the next 3 months for best practices?
Right. So, I mean, the only clients I know that are meeting in the next 3 months of ours at In-House Physicians are companies that are wanting to do smaller meetings, very small meetings, and we're creating safe zones for them. And I think that will translate into when we start to have meetings again at the end of the fall and into the winter. And thanks for bringing it up, the acronym PDR. It's a global public health term that has been very effective in the global public health arena, but it's also being used now in return to work programs for employers. So it's a concept around health security, and the 3 principles are prevention, detection, and response. And so those are the those are the primary elements that we're going to have to implement at our meetings. Prevention are things like if having strong sick attendee policies, because the easiest way to prevent an outbreak at an event is to actually prevent people who are sick from coming to the event, or when they are sick at an event, keeping them at home. Social distancing, we'll have to be using masks over the next 2 or 3 months. I don't know if we're going to be still having to wear masks as a mandatory thing as we move into the fall and the winter. I suspect the things are going to loosen up in that regard. But we're also going to have to do things like detect, which are surveys when people come on site, temperature checks. I would recommend outsourcing those surveys to a third party that's HIPAA compliant, because you don't want to be dealing with personal health information. And then finally, many of you may think this is over the top, but I predict that on-site or near-site access to COVID testing is going to be really important.
Absolutely. So now, Tracy,
Yes.
you have been the go-to person for safe food service with a focus on personal needs, allergies, and sensitivities, and keeping people healthy and high-performing during the long days and nights of events. So obviously, we're seeing this current leaning in just in the very short term for people to stay at home and do more digital events. And then we're also, as we're starting to see, as people start to talk about the return to food and beverage, leaning to everything being individually packaged with plastic utensils. So obviously not sustainable, although it does easily allow for things like your own individual meals and all those requirements being met. So how are you seeing, again, with just meetings that are coming up in this near term, how are you seeing food security being addressed in the near term?
So a couple of different philosophies are out there, but a lot of the chefs that I've been talking about are doing it in phases, kind of like we're doing the phases of coming back to having meetings and just opening up businesses. But, phase 1 is all restaurants are going to be closed, all buffet stations are going to be closed, or they're going to be served by servers, presenting the food to them, whether it's a, pre-packaged food and beverage option. One chef I was talking to was, doing it instead of everybody coming and convening into one big ballroom, doing the food and beverage in the small breakout rooms instead, and having it come into those rooms versus everybody coming in, out and convening. You'd have to do it or staggering your meal functions like we were in elementary school and high school, and period 1 goes, these are the 5 rooms that go here, and period 2 lunch, these are the 5 classrooms that go at this time. So doing it that way. And then phase 2 is kind of opening up those buffets, but again, with the service by the staff and not you and I touching that silverware. And although, the CDC, the World Health Organization, and FDA have said that, COVID-19 is not passed through food and beverage. We still have to worry about Listeria and Campanella and, all of those other E. coli, but not COVID as it relates to the food and beverage that we're serving. But last week they also said that the likelihood of getting it from touching a surface is one of the least obvious ways that you're going to get it. But you still have to be cognizant of that. Having 500 people walk through and touch the same tongs is not ideal. So figuring that out, but having that staff, and I think the staff issue is going to be another challenge for all of us, is because all of these staff have been laid off and furloughed. Getting them back into being able to staff these events, granted, as Jonathan said, they're going to hopefully be smaller events, and so we're not going to have 7,000 person lunches anytime soon, but kind of staggering, figuring that out. And then the third phase would actually be going back to quote unquote normal, into having buffet lunches and plated meals and things like that.
I feel like we're so far away from buffets. So
Yes.
we're seeing a lot, in the chat, people are telling us most people are moving to digital as well and pushing their events forward into 3 months, or just doing events that are, well under that 50-person mark. So, we're sort of seeing the same thing. So much fun to see people here that it's names I recognize and names that I don't. So Tabitha and Carrie and Kevin and Kelly and Sarah, welcome. So exciting. So we've definitely, and again, if you go back to last week's webinar, there's some really great information on the surfaces and the touching and how hotels and venues are working with that. So, all right, so let's imagine ourselves we're in the late Q4 of 2020, when we sure hope we see the world traveling again safely. Now, we've all seen what they're doing with airports. I think you'd have to be living under a rock in our industry to have not seen at least one article that says, how we're going to go through airports and what that experience is going to be like. So let's assume that people arrive by air to our events, but we know that they don't have fevers because they've already been through 14 temperature checks. One of the questions we've had come up is, do we think it's going to be a privacy issue to check everyone's temperature or to do testing? Jonathan, I'm going to give that one to you, obviously.
Yeah. So well, I'm not an attorney, so I'm going to qualify what I'm going to say. But what we're seeing, at least in the employer space, is that the standard rules don't apply with the pandemic, and that you can ask personal health information questions as part of a survey. You can do temperature checks, and I think by the time bigger meetings start to become active again, employees, our society in general will be really comfortable with temperature checks and yeah. So the word on what I'm hearing from the legal side is that it's acceptable.
Well, and we're certainly seeing it everywhere, office buildings and airports, and so I think that is really part of our current normal in many cases. So
yeah.
now we imagine in 6 months.
Tahira, can I ask?
Yeah.
All right, Jonathan, I want to ask. So there was an article or something that I saw on the news, though, getting the results back from not the temperature checks, but the COVID test. We don't, as an event planner, we don't have the time frame unless an instantaneous test like a temperature, having that availability and the cost of that is going to be prohibitive. I mean, how do you get that?
Yeah, PCR testing right now is primarily still being done with a send out to a lab. And that's what we're doing at all of our COVID clinics. However, we also have rapid testing as available as well. And so that will, at least with in-house physicians, will be providing rapid testing with results in 10 minutes for patients. Now, if you're just thinking about patients, that I would initially just say, hey, you're not going to screen everybody that comes. That's going to be cost prohibitive. But if you're screening people that either don't pass the temperature check, or say they've had flu-like symptoms in the past 14 days, or say that they were exposed to someone with confirmed case of COVID in the past 14 days, those people would be funneled to say, hey, we really need to do testing by this third party before we feel comfortable having you come into the event.
And I wonder too, I mean, if someone's denied entry, what sort of legal implications that would have, and how's that going to affect, say, attrition if the hotel denies them entry?
Right.
I mean, all things I don't know if anyone has the answer to that will
Nobody
be
has the
worked
answers
out.
yet.
Yeah.
We're all working through what that's going to look like, right? So we have sort of 3 questions rolled into one, which is, as we get into between 6 months and a vaccine and building in safe zones, and who's responsible for that cost? I mean, really, it's, is it up to the company or person putting on the conference or the event to do those things like temperature checks? And some of those we know the answer to. Yes, it's incumbent upon, if you choose to add those as your costs. And we've seen that with some meetings that are happening now this summer, where they're adding, taking out one element of the event, whether that's food and beverage or, keynote presenters or whatever it might be, to have temperature checks and safe zones. But tell us more about what does a safe zone look like at an event right now in that sort of 6-month pre-vaccine time zone?
You're talking to me?
I sure am.
Me.
Unless Gareth wants to answer, I'm sure.
Well, I mean, it is going to include social distancing. You're going to be handing out masks. I don't think you need to wear gloves, but masks. You're going to be doing temperature checks and surveys every morning when they come in. You're going to have, if it's not on site, you're going to do some prep work and find out what urgent care or what medical facility can you send people to get PCR testing. As Tracy mentioned, you're going to have the food restrictions that are going on around how you present the food. And then you may want to be doing, you may also want to be doing PCR testing on a regular basis for the meeting staff or the staff that's going to, whether it's the venue staff, you're going to want to make sure that they are, COVID safe. So you may want to require them to go through some type of surveillance PCR testing for that venue.
It's going to be a tough one in between now and then, because it's something that, we're not comfortable saying to people anything other than yes and welcome, please come into our event. So I think that's going to be really, an interesting thing. So Tracy, we're just going to flip a little bit now. So food and beverage still. So you've been talking to chefs.
Real quick, we had just someone wanted to clarify, what does PCR testing stand for?
Oh, I'm sorry, polymerase chain reaction. It's the technology that's used to identify the viral RNA, the genetic code, and it's the most commonly used test to determine if you have a current infection of COVID.
Oh, that COVID. So, Tracy, you've been talking to chefs across the spectrum, hotels, restaurants, market stands, convention centers for years, and also now more recently on what they're doing right now. So, how are people responding to different kinds of food service during this time? What are the changes you're seeing that you think we might be carrying into our events going forward?
Well, the one thing that I have been pointing out in everything is that food safety standards have always been there. It's always just been behind the kitchen door. And, not that they've done necessarily, everybody does a really good job with allergens, but they do a great job of making sure that they're following food safety standards, the US Food Code, and whatever the European codes and et cetera. But now they have to move it forward. And so making sure that their staff are wearing gloves and wearing masks, because it's going to be an optics issue, that people want to see how things are going to be done. And it is definitely going to be training their staff, especially their front of house staff, on a lot more food safety practices and what this means, and making sure that, and part of the food code regulations is that you stay home if you're sick. And so those employers are really going to be doing those temperature checks as well, and pushing their employees to stay home to make sure that they are not, getting anyone else sick, and really making sure that stands still. But, sneeze guards and box lunches and plastic boxes. I'm not keen on the sustainability aspect of that, but also I saw it on a hotel door, putting the sticker on the door to say this door has not been opened since it was cleaned, but doing the same thing with a box lunch, making sure it's sealed but I really want you to make sure it's labeled correctly, especially for dietary restrictions. And let me tell you, dietary restrictions are not going away, and you still by law have to accommodate for those individuals. You can't just say this is what we're doing and that's it. You still need to accommodate those. And everybody I've talked to is pretty much still doing that. So, but I think box lunches, getting rid of water pitchers and water jugs, the servers are going to have to be passing those out. Canned sodas and bottled water. I cringe on the bottled water going forward, but it will have to be served by the servers.
Well, it's also now, right now, we're not just seeing bottled water. It's like your bottled cocktails and your bottled everything.
Right,
and I think
exactly,
it's a bigger problem.
The state of Illinois, the governor, I think, is making to-go drinks legal from here on out. I saw that this morning. So, you know, and if you're doing cocktail receptions, hey, here's your drinks to go. But, you know, to go back to your room.
Well, thank God for companies like Plastic Bank that are working to collect all of those plastic bottles and help people around the world who have needs that come from those refunds, and companies that will take that plastic and recycle it, because that's another whole issue we're going to have to address. So, Gareth, you've been quiet for a while. So, as you listen to what Jonathan and Tracy are saying, and your clients, and thinking again past these 3 months, not just digital, but now we're going back into our live event scenario. How are you and your team thinking about what are some of your redesign elements that you're thinking as we move into that phase?
Yeah, you know, as we start to think about people coming back, there's so many different levels to this. We've talked a little bit about health and ability to be able to come back. The hotel has a definite responsibility, or venue has a definite responsibility. We're communicating with them already to find out what is happening in the industry, what's being projected out there, what are they doing as an operation, what's the new norm going to look like, and how can we ensure that the safety of our guests in those venues. It's really interesting right now. I had a client, almost 1,000 people, that we had a 13,000 foot ballroom, almost 14,000 feet. And we were planning on having 600, 700 people in that, which wasn't going to be a problem at that time. Under the new guidelines right now, with the setup that we have, I could fit 60 in there on a CAD design. So you've got to relook at the space that you have. You also have to look at the personal side of things and what are people comfortable doing? This isn't just some things are mandatory and you have to attend, but other programs, we certainly know in the industry are optional to be able to come to. So what are people's comfort zones and what they're going to want to attend, and how we make sure that they're safe if they do attend. And if they don't, we're putting together a hybrid type event where everything is also digital. We want people to come back out. We want them to start interacting again. We want to make sure that they feel comfortable and they feel safe. I think industry-wide, we're going to get a lot of cues as individuals from major things happening like sports. I think that's a big part of it. We were actively involved. I mean, our foundation is built on sports. So like we were going to the Olympics and bringing some incentive programs to the Olympics. Well, all of a sudden that changes. So you talk about incentives and you talk about the people who want high touch and are rewarded for their actions. We still have to reward them. We still have to do things for them and make sure that they have a very high touch component of things. And how does that look as we move forward into live and at-home programs? At-home programs right now, word and digital programs, we're very much looking at the touch side of things. There's been a lot of talk about technology, and there's some great programs out there and coming better into the future. But there's not a lot of talk about the touch side of things. So we're adding a lot of experiences, a lot of chefs out there, a lot of wellness coaches out there, a lot of comedians, a lot of people, mixologists, Olympians, athletes, speakers, things like that, because we're all a little bit kind of zoomed out. There's a lot of platforms and Zoom and Instagram and everything else, but we're needing to kind of get a little bit more high touch, things delivered to our house and things along those lines.
I agree. That's definitely some of the things we're seeing. So we've got some good comments and some good questions. So we're going to go with, so one of the comments that just ties into what you said about, sports and things opening up is, around the Republican National Convention. And they've said, we will have 50,000 people. Well, if with these new guidelines, you would need to have a minimum of 1,800,000 square feet for that amount of people to meet. minimum, and forget about staging and drop stations. And so find me a venue that's that size where you can have everyone in one place. I mean, it's just, that obviously to me, that to me is an obvious, we need to rethink. What does that look like? What other venues do you need to use? How do you create that hybrid experience? But I'd love to hear, what you guys think about that as well.
That's my state that's dealing with that at the moment.
What do you think, Tracy?
I think they really need to rethink of how they're going to do it. I mean, because I don't really think that all of those people want to be in that convention center at that one time. And you've got multiple hotels, chains having to work together to figure out how to implement all of that and to do all of that testing. And I know with the American Hotel and Lodging Association, they've got new standards that they're all committing to do. But how does that, as they each try to do their own level of standard, which is very valuable for their own, constituents, but it's going to take a lot more effort. It's going to be like planning the Olympics, Gareth, on the RNC probably wasn't as big as the Olympics, but it's going to be that big of an Olympics, and shutting down the streets to get people to go between hotels and convention centers and standing in line to get in. And the lines just to get into that building, if you're doing temperature testing and COVID testing, I mean, that's just going to be nightmarish. I could say another word.
And I have to just say, I've been thinking about this too. And going back to when MPI, I think, made the good decision to postpone their event to November. What are the marketing and PR costs if you have a giant convention and there's a giant breakout of COVID? I mean, that could be the end of your organization. I mean, what is the risk there you're taking?
This is where I'm glad that I'm Canadian and don't have a political opinion. So, but this also, some of the other questions that have been asked, temperature checks, somebody's, Nicole said, they've been hearing temperature checks are outside our duty of care since we're not medical advisors and could open planners and corporations up for liability. And again, none of us are legal experts here, so I think we're not going to answer that specific question. Sorry, Nicole. But other questions have been around, how do you get those tests and have those testing? And that's actually one of the reasons we invited Jonathan here today, because In-House Physicians is exactly one of those organizations that can provide the personnel who are medically trained doctors and nurses to provide that kind of care and work on the access to those kinds of tests. So two things. So one is the first part is, can you just talk a little bit about what testing would look like for you and with the difference between a 50-person scenario and a 50,000 person scenario?
Yeah, so to Tyler's point, it's going to be we're in a tug of war situation here where you're going to have people saying, oh, that's not in our duty of care. Well, it's going to be, because you have the other pull on the other side that Tyler had mentioned. What if you have an outbreak? Let's say you do have a meeting this winter. Let's say you wait till March of 2021 and you have a meeting, COVID is still going on, flu is still going on, and you don't do these things. What's your liability for now having a big outbreak and saying, like, well, all the employers are doing temperature checks, everyone else is asking surveys, so why aren't we? But I do think whether it's In-House Physicians or someone else, you should shift that responsibility to a third party. That's, their bread and butter is protecting personal health information, that they're a covered entity under HIPAA, because even though meeting professionals aren't a covered entity under the HIPAA regulations in the United States, you still have to follow state and federal regulations around protecting personal health information. So as far as testing, I think what you're going to have is you're going to have a large, for small meetings, like give you an idea, one staff person, which is at a very low, inexpensive rate to get someone to do temperature checks, infrared, no contact thermometers, they can handle about 250 to 300 temperature checks an hour. So, for a small meeting, you may just have one person. For your 15,000 person association program or a large corporate event, you're going to have quite a few of them, right? And you're going to have them there for at least 3 to 4 hours doing temperature checks in the morning. So the surveys can be done during the temperature checks. We're working with a another entity in the meeting industry on developing one that people can just do on their phone. So they can just do it on their phone every morning, and they just have a QR code, and then they just pass through once they do the temperature checks to make it easier. So we're trying to find ways to make it more efficient and cost effective.
Which that's all we can do, right? It's like anything. So it's, you know, figuring out sort of what that next is. So now let's say we've moved into a time, hopefully in the not too far off future, but let's be real. I did medical meetings for a lot longer than I've done any other kind of meeting. Where we have a vaccine, those don't happen overnight, we know that, or some, you know, a bit of herd immunity. So where we have enough people have received it that now are immune to it, who have recovered. We've got, you know, budgets for events and conferences and incentive travel are being reinstated, and we have a return to more live reward and recognition events. And what is our crystal ball telling us about, you know, what's that going to look like? So Tracy, do you think, you know, a huge part of our events is food and beverage? I mean, we know it's like 25% of our spend, right? So do you fundamentally think, I think fundamentally we've seen the end of flying food and buffets for a while, but that's just my opinion. So what do you think is going to happen as we get sort of into that and sort of, you know, past the 6 months, and now everyone's feeling a bit more secure in traveling to some extent to meetings again?
Flying food, donut walls, I think those are gone for a good while. You know, everybody picking, you know, it's like going to the grocery store. You pick, oh, I don't want that one, but I want that one. Yeah, I think that's going away. Past hors d'oeuvres are definitely going to be gone for a while. And it is going to be, I think if we can, I was searching sneeze guards so much. I was expecting the Facebook feed to come up with advertisements on sneeze guards on my feed. But, you know, how can we, you know, create better ones that look like that? And, you know, having staff, I think it's going to be buffets, but more action station buffets, and, you know, small plated tapas, which we've done before, but also more seated, you know, dinners, and utilizing more space. You know, can you take that dinner outside? You can't do that in the middle of Montana in the wintertime, but can you spread the group out so that it's not so congested? And I think bars, that's a whole nother thing. We usually have really long lines for bars, so we're going to have to actually add more bars around the rooms so that we can make those lines shorter, and get those drinks processed faster. But I think, Gareth, I mean, that's a huge labor charge as well when you're adding more bartenders on there. So I think it's definitely, and I think you also, with all of this, no matter what, you're going to have to put your standards on your food and on your event apps and on your event websites. What are the food and beverage standards? How are you doing this? Making sure those FAQs are answered. But I think donut walls are gone for a good while.
Yay, actually. So
Yeah.
that's, you know,
I think also, sorry, you know, instead of it being open food on a plate, maybe it's, you know, individually in little mason jars or things like that, that can actually be, somebody can pick it up without touching another plate easily. But I clumped together food is gone for a while.
What would Homer Simpson say about the donut walls going away? He's going to break his heart.
Yeah.
I feel bad for Homer, but I'm okay with it fundamentally. So anyone who has ever heard me speak about food or, you know, meetings and event design is I'm on a mission to erase beige food from all meetings because there's just really no nutritional value across the board. So I'm all about the no donut wall, but that's, you know, it's my little soapbox. We've got a few good questions. One is about, you know, are there social distancing calculators out there? There are. The CDC, the Centers for Disease Control, has put out a massive document on how to return to meetings safely. And from that, many other groups have extrapolated information. So I've put some of those into the Q&A, but there's many, many resources. The reality is we used to base, and we all know that sales hotel guidelines were always a bit fudged anyhow, but as soon as you put in some drop stations and a stage. But the reality is, you know, it was based on theater seating at 10 square feet per person. And right now, if you look at a 6x6 space, you're looking at 36 square feet per person, or almost quadruple the size. So as Gareth said, you know, in drawing some of those rooms, they literally don't even make any sense. And how do you fundamentally as a venue take a room that you were selling for 100 people and sell it for 10? And then what is your food and beverage on that all of those things. It's just we don't have a good rates, dates, space scenario yet for getting back into meetings with these new safe space guidelines. So that's why we're looking at this in a 3-month, 6-month, phased approach. And again, we're at the crystal ball stage. So Jonathan, are we ever going to go back to just showing up at events? What are going to be some of those things? So, and then we've had a question from Maria that says, what do we tell people who have a temperature rise during that check, who may not be the same age as me? Do they go back to their room? Are they allowed in the hotel? So what are some of the things that we're seeing with the American Hotel and Lodging Association guidelines? What are, some of the things that are happening out there?
Well, I think with temperature checks, it doesn't stop with temperature checks. If you start to detect, if you're going to take the step of detecting things, then you have to, as part of that PDR, you have to respond to it. And yeah, if someone has a temperature, then they have a temperature of 100.4 or greater, or if you have a lower number, then they can't be allowed into the meeting. They do need to go to their hotel room for quarantine, but now you have another responsibility that you may not think is in your duty of care, but it is. You have a responsibility to have pre-planned giving them access to medical care. Maybe it's an urgent care, maybe it's on-site medical care. Don't send them to the emergency room. That's where all the COVID patients will be. But you do need to take the next step and say, hey, I need to get this person evaluated. Why? Because guess what? Let's say they do have COVID and their temperature goes away spontaneously tomorrow, and then they pass the temperature check. Or let's say even worse, they still have a temperature, but now they're taking Tylenol and ibuprofen to get through the temperature check. Are you really helping by just putting that person in their room and saying, good luck, come back when you don't have a temperature? You're gonna have to do more than that. As far as long-term, I'm a little cynical about society. I feel like we've been talking about pandemics for 20 years. I've been working with large companies on pandemic preparedness for the past 10 years. I do believe, maybe not in a year, but maybe 2 years, we will get back to doing things as usual, because that's who we are. When something's not really bothering us anymore and we forget about it, then we go back to normal ways. What I hope, though, is that the industry as a whole, right now the meeting industry is inherently part of the problem, not part of the solution, because we bring people together. But I do think there's an opportunity for the industry to have a wake-up call and say, hey, we can be part of the solution. And there's a lot of ways you can do that, even being part of the World Health Organization surveillance team and being able to identify when things are happening.
Like you said, prevent, detect, respond. All right, Gareth. How are we going to create these best experiences from an event designer perspective?
Creating them isn't the problem. We are all the most creative. I mean, everybody on this call has a gazillion ideas and has put together fantastic programs and is taking care of their clients better than they could possibly imagine. So creating those aren't the problem. The challenges come in what can you implement and what are the costs associated with it. Again, for the foreseeable future, we're talking about a lot of things here, and a lot of conferences can't absorb those costs and don't have the fiscal wherewithal to be able to do that. So how do you do that? One of the things that we're absolutely looking at, again, based on the fact that we probably for a while can't have those massive programs, is having smaller regional programs and traveling closer to people's homes and having them feel more secure about going in. So as opposed to having a 1,500 person program, maybe you have a 1 or 2 or 300 person program in 3 or 5 different places around the country. That's an ability to be able to manage numbers a little bit easier and let the system kind of catch up while still having an economic effect to the industry. I fully agree. I mean, the meetings, the industry, it is amazing for the revenue and how we can be helping the economy. And we have to be coming together and saying we can be part of the solution. And I'm glad we're here discussing this and kind of coming up collectively, because there's a lot of discussions out there. There's a lot of unknown. There's a lot of misinformation out there, and that we're having to kind of share and educate all of. I think we kind of forget sometimes that we're probably have a better touch and feel of what's going on industry-wide. Many of us travel, not only just local within our region, but nationally and internationally. So we're getting our information, we're getting our decision-making abilities from around the globe. Again, we're not in a bubble. And that's the other thing to consider too, that you have to look at is, okay, so you're talking about 300 people or 500 people or 1,500 people, but they could be coming from 100 different destinations and 20 or 50 different countries and things like that. So how is that ripple effect kind of come on through? I think it's important for us to, as an industry, continue to communicate. There's been unbelievable creative ideas that have come out there, and we've been very good in the past, in the even past pandemics. Think of the Roaring 20s that happened after the 1918 things. The Roaring 20s came out of that. We can help drive that, and we can help kind of come together. And communications like this are really integral. We want to talk to all of our clients. We want to talk to all of our, industry people to see what best practices are out there and come up with guidelines as an industry that make best sense to tackle this and move on.
One person at a time, right? So, when the vaccine becomes available, should we make it mandatory for guests to show proof that they've taken it? That's going to be a tough one, isn't it? It's not a bad idea, but it's sort of like when you travel to countries where you need to have typhoid or malaria. We may get to a point where there are certain things you have to prove to cross borders. That's just my guess. Anybody else? What do you guys think? Should we consider having all guests wear face shields and gloves? I think we're definitely seeing that for the summer events. What do you think, Jonathan? Should we have people wearing face shields and gloves?
I mean, for this summer, unfortunately, it kind of is like the antithesis of having a meeting to have to wear a mask. But I think we're gonna have to wear masks for at least the next couple of months. Gloves, I don't think are really valuable. You can
wash your hands.
Wash your hands. Hand sanitizer. Gloves can go either way. Yeah, I think it's also interesting to look what employers are doing. So a lot of people are asking questions about the legal implications of asking personal health questions, making people wear masks, doing temperature checks. What I would recommend, and we have a whole nother program, not just in the media industry, that we're working with a lot of large employers on return to work programs. If you start looking at your company's return to work program or other companies' return to work programs, use that to model what you'll probably do in the meeting industry, because they're already setting precedents by being able to do the things that they're doing. And I know these attendees are not your employees, but they may be the employees of the host, of your client. So you can use that to kind of guide you.
So I think there's definitely a lot of chat going on. So the chat is very interesting. Make sure you export that later, Tyler, because this is fascinating. We put some links into the chat as well for people to the American Hotel and Lodging Association's guidelines. Most hotels are now following that. I've seen guidelines from...
We're actually just getting ready to put out a podcast with with Chip Rogers, the CEO of AHLA, on that subject any minute now. So watch your inboxes.
Perfect. Because those are the kinds of resources that are being followed. And like I said, last week's webinar that I watched before we started this one was fantastic, and really around that whole lodging hotel experience, which I think is really important. How are we going to be able to secure the resources mentioned for one-off events, such as a quick breakfast meeting? That's a good question. I would say that's going to be working with the professionals. So if you are doing something that's a small meeting and you feel like temperature checks and or any testing are going to be something that you want to include, then again, working with in-house physicians or similar groups in your city are going to be that resource for that.
Can I add one more thing about food?
Yes, please.
So if we've all seen the news about the supply and demand, or the supplies of meats and pork and vegetables and things like that. So planners are going to have to be very cautious in talking to their catering partners on the cost of food, because farmers are not necessarily going to be replanting everything that they have normally planted like this time last year. because the demand is not going to be there. So, which will jack up prices some as well. So looking at that, but working with and asking your food and beverage partners, who are they using locally? So they're not actually having to source from far away to get a lot of that. So what really focusing on what is in season and what those farmers locally have. I think that will be another big push positively for the sustainability standard, Tahira, versus, you know, hopefully it'll outweigh the plastic bottles that we have. But definitely look at and go to localharvest.org. You can find out what's in season in the city that you're going to. They post that a lot, but that is definitely going to be something that we have to work really closely with our chefs on.
I love that. Gareth, will you share your, are you going to save that idea for yourself, or will you share that fun idea that you had at the beginning?
Yeah, we were talking about face masks, and Jonathan, you know, called it out. I mean, you know, really the nature of the business is really hard. I mean, we really want to look at each other and see facial expressions and smiles, and you know, when you're not smiling. But if we are wearing face masks, I've definitely come up with the idea that the face mask should actually be your name tag. So mine would be Gareth Heyman across my face. Makes that awkward moment of looking down at somebody or trying to read or squint and kind of catch their name. You can keep eye contact all along, and having, you know, a face mask, and you can be creative with it and put the branding and the logo of your client on there as well. So it could be right there in front of you. And I do like the idea of a little flap to have a straw come in for your beverage.
I like the idea also of having, like, maybe taking pictures when they arrive, and then also having a picture like the physicians do on their jackets.
Yeah.
So you can see a big smile and you can see the person.
Yep, that I like. Because the doctors were doing that in hospitals when they were going in to see patients. I love.
Yeah, in New York, in Manhattan.
Yeah. Hey, Tahira, there's one thing on here. Dana mentioned, you know, it's going to be hard with so many staff furloughed or laid off, of getting answers about this. And 100% agree, Dana. And, you know, sometimes right now, the only person on staff from the culinary team is the executive chef. So I think all of us have to realize that doing even this training, front of house training, and even more consistent back of house training, they're going to be coming back in and they're going to have a meeting and they're going to have to start training it, you know, like this, and get their property back into place all at the same time. So we all, as much as we want to have to get back into it, we have to be patient with them all as well. You know, we have to do this as a partnership, I think even more so than what we were in the past.
Tracy, someone had mentioned about, and Tahira is going to love this, about more whole plant-based foods.
Mm-hmm.
I wanted to mention one thing, and that is, it fits into that as well, is that we're exposed to viruses all day long, every day, and we don't get sick. Why? Because we have this magical immune system. And this magical
I love you.
What?
I said, I love you. Thank you.
We have this magical immune system, and we don't treat it right. And what are the things that affect our immune system? You know what they are. Stress. When you get really stressed, you're more susceptible to illness. Sleep. When you don't get enough sleep, you're not getting the 7 to 8 hours. Same thing. And nutrition. Nutrition is so important for your immune system. So I'm totally on board. I don't know how many carnivores we have on the line here, but moving towards more of a plant-based diet is really good for your health and for immune system.
All right, so we've still had a couple of questions about, is there written guidelines that we can use and follow? Yes, there's lots of them. So again, we put those into the chat, but the CDC, so the government organization, literally if you just type in CDC COVID events, you'll get those guidelines right away. And they're great, but it's about 35 pages of reading, so be prepared for that. I've probably read 4 pages on event safety in the last 3 weeks. So there's a ton of information out there, and everyone really has the right idea. We're going to see more cleaning, more sanitation, more visible, and everything, you know, lots of stuff behind plexiglass, lots of things that get mailed to you ahead of time that are you're going to be bringing your own name badge and your own color-coded masks to the meetings. The American Hotel and Lodging Association, again, we put the link in the chat, and Tyler, I'm sure you can also you can make a little blog post that includes some of these great links for people. But but do know that every airline, every hotel company, every DMC that we're talking to, every third-party agency that we're talking to, everybody is working on training their staff, understanding what safe looks like, and making sure that as we return to events, somebody also asked earlier, should we be testing with smaller events? 100%. We're going to be doing, global, local, we know that travel is going to come back, local, regional, some national, long before international, for most people. But let me put that also in context. So, when I saw a statistic that said that when 9/11 happened, there was 1.7 billion people flying that year. We're now at about 4.2 billion people flying a year. So even if we are down to approximately 10% of flights going, you can do the math. That's, 400 million people are still flying places. So it's, these are not insignificant numbers we're talking about. We can all agree that we want to see our economies come back, and we want to see live events come back. And how do we do, and it's just important that we do that safely. And, as Jonathan, you said at the beginning, it is about protecting our most vulnerable. And our most vulnerable aren't necessarily the people who are attending the bulk of our meetings and events, but it's those people who can go and get exposed. So, if we're going to events, maybe you're going to those events, and if you know that you may have run a risk at some point just by being in a larger environment, don't go and visit those older relatives for a couple of weeks. Give yourself some time, so it's, there's ways that we can be individually smart about it as well as collectively smart about it. I'd love to, I was just gonna say, I'd love to give you guys all a chance to wrap up with your final thoughts as well. So it's Tracy, start, because you were starting.
I was like, I live with my older adult relatives. Yeah,
it's a problem. Don't hug them.
Yeah. I think it's the patience, it's figuring it out, it's asking questions. And the thing is none of us know the answers to it yet. And so I think really looking at those smaller meetings and how they do work and how we can implement them and see how they go forward, I think is the best bet. But just, I think staying optimistic and positive about it and figuring out new ways. I mean, it is a struggle, but that's where innovation comes from.
Jonathan.
I'm optimistic. I'm super optimistic over the next several months. I think things are going to get better. Employers are going to go back to work. Kids are going to go back to school. And the industry is going to be really ramped up and ready to go for Q1 of 2021. However, you better be ready with, I'm just going to say health security again, with really discipline with health security measures, because guess what Q1 of 2021 is? Flu season. And you're going to have a resurgence of COVID. You're going to have flu season. You're going to have people with colds, and you just got to be ready for it. But I think we can do it. Yeah.
You know what I want to go back to? I want to go back to say, like, let's say last January, when we were fortunate enough to have Jonathan and IHP come to our global conference, and they set up the most beautiful wellness lounge. So instead of having to worry about sickness, we had to worry about people's wellness. And I look forward to that day happening again soon.
Amen.
We have had just a question. I'm going to turn this question to the audience, then we're going to go to you, Gareth. For those who still have events on the calendar coming up, how did your layouts change? And what obstacles have you run into in order to accommodate proposed social distancing? So it's from an anonymous attendee. So I'm going to turn this to the audience, put into the chat if you've run into obstacles and what you've had to potentially do to accommodate those. And if you just click on sending it to all panelists and all attendees, then everyone gets to see it. So Gareth, what are your final thoughts on where we're at with our crystal ball of events in an insecure world?
Yeah, I'm confident. We consistently overcome obstacles. We work together, we communicate. I think the communication factor is by far the strongest part here, that even more than in the past, we always communicate with our clients, we communicate with our vendors. We really have to be talking to hotels, and destinations and convention centers and DMCs and all of our providers to make sure that they're on the same bandwidth that we are, and that they understand what's going on, and that they appreciate that we understand that we're working together in a team, as well as communicating with your client and frankly, the bean counters that said, you know, we have to make some adjustments to this, and it's not going to be the same thing that it was in January. I mean, I long for those times too, and it's going to be a ride. I mean, it's going to be a little bit longer than I think some people have admitted to at this point. And I am again optimistic towards that future, and I think that we also have to, like, we look at every event when we do the Olympics or any event that we put together a safety protocol, and we put together a whole book of what ifs. And, you know, COVID and a response and an outbreak needs to be part of that protocol. And you need to discuss it with your internal team. You need to have a plan, and you need to be able to know what to do and feel confident for your clients, your employers, whoever you're working for, if you're an internal organization, whatever, to be able to react on those safety sides of things. But we're going to get through this. I mean, we're all healthy. We're very intelligent. We have technology like we've never had before. We have the ability to talk like we've never had before. And we have the ability to be able to solve solutions like we never have. And technology is going to work a lot faster than building a new ramp of a convention center or access into a door or something like that. So we're going to see some positive changes from that. And it's in the works right now. And it's getting funded right now. And that's going to be a real game changer, I think, for us. That's going to be the biggest thing that we're going to see moving forward, much more than how do you space out a ballroom a little bit differently. A ballroom is a ballroom. You can't do a whole lot with that physical space. So the technology is going to embrace technology, do something. It's going to be our friend.
So we put this webinar on the book months and months and months ago with Meetings Today, and the original topic was how to plan international meetings, because that's what I spend the majority of my time doing. And a few weeks ago, I reached out to Tyler and said, "This is actually the most ridiculous thing. What am I supposed to talk about? International meetings when we can't cross borders." And I'd like to thank you, Tyler, for pivoting to us with this topic, and to Dr. Jonathan Spiro and Tracy Stuckrath and Gareth Heyman for joining us today. You guys you're so knowledgeable. We barely honestly scratched the surface. I mean, I've spoken with each of you for hours, and am just always impressed with everything that you think about and bring to our meetings and events. Thank you to this massive audience for joining us today and for your complete engagement in the Q&A in the chat. We really appreciate it. That's what makes these great. So Tyler, I'm going to turn it back to you. And thank you.
All right. Thank you, guys. Thanks, Tahira. And I'm glad you brought that up. I was going to mention that. Thank you for suggesting that. It was like just a no-brainer sort of decision when you brought that up. And then we actually, here we sort of reconfigured all our webinars. And luckily, we have such professional presenters, such as yourself, that they can pivot fast on stuff like this to get the audience what they really want to hear in this time. So thank you to all of you guys. It was amazingly informative presentation today. And we're almost out of time here, so I thought I'd just remind people of a few housekeeping items before we go. So be sure to check out our next webinar on June 24th. 1 p.m. Eastern, Planner and Hotel Sales Relationships and Expectations in a Post-COVID-19 World, presented by Marianne Bobrow. Like I said, she pivoted and got this out there, and so that is going to be a very, very interesting program too. And also remember that you can find this webinar on demand on our website, as well as our past webinars. So head on over to meetingstoday.com to check that out. And as we sort of mentioned during the presentation, such great chat, questions, and observations coming in. So I'm going to gather all that together and make sure everyone can access that too. So, and then wrapping it up, thanks today's webinar sponsor, Destination Colorado. Thank you, Destination Colorado, for making it possible to bring this free to everyone. And once again, thanks to all our wonderful panelists for joining us for this webinar. Have a great day, all of you, and we hope to see you again soon.